The same changes you make to have an optimal cardiovascular health, maintaining a healthy weight, exercising, making sure your blood pressure is in check, making sure that your cholesterol is well controlled, are in general good for the prostate as well. So BPH is benign prostatic hyperplasia, or an enlarged prostate. It's basically enlargement of the prostate that's not related to cancer. It's very common. It tends to occur as you get older, and it's variable. Your prostate does grow no matter what as you get older, but some men, just due to genetic reasons, have much larger prostates. The prostate sits at the base of the bladder and kind of acts like a spigot. As it enlarges, it also restricts the flow of urine through the urethra. So in general, as the prostate gets bigger, it compresses the urethra and it leads to urinary symptoms. Not always, but some of the symptoms you can expect if you're having this sort of obstruction or a weak stream, straining, having to wait before you can start your void, getting up multiple times at night. And sometimes it can lead to overactive bladder symptoms as well, like frequency or urgency. One thing you have to realize is unless you're symptomatic from it, or unless your enlarged prostate is causing problems for you, and usually the problems that I'm looking at is obstructing the flow of your urine coming from your kidneys. Is it causing frequent urinary tract infections? Is it causing stones to form in your bladder? Is it causing blood to come from your prostate over and over again? Those are more of the hard reasons that I encourage patients that we have to do something. Other than that, having an enlarged prostate, the problem is really symptom-driven. So I have patients with very large prostates that have zero symptoms and have no problems emptying their bladder, and there's really nothing to be done for it in that situation. But if you are having symptoms related to the prostatic enlargement and the obstruction of urine, then there's a number of different medical and surgical treatments available. So risk factors for prostate cancer, it's obviously men that are involved. Age is a risk factor, so the older you are, the more chance you have of developing prostate cancer. African American ancestry is a risk factor, and family history is a risk factor as well. So if you have a first-degree relative, a father or a brother who has a history of prostate cancer, you're at increased risk for it. Any signs or symptoms related to prostate cancer are actually very rare unless it's an advanced form of the disease. The majority of the time nowadays that we pick up cases of prostate cancer, it's based on a screening tool called the PSA, which is a blood test. And the advantage of the PSA is that we pick up on prostate cancers very early when they're localized to the prostate without any spread, and they're potentially curable at that point. Some of the signs of advanced prostate cancer may involve difficulty urinating, blood in the urine, pain related to metastasis or spread of the cancer to other parts of the body, including the bones, weight loss, and constitutional symptoms like that. So a short answer to that question, no, not all men are going to benefit from prostate cancer screening. So there's different guidelines. The American Urologic Association recommends men with normal risk to start at about age 55 up until about age 70. And with any recommendation from these different guideline bodies, if a man's not expected to live over the next 10 years due to a very advanced age or serious illness, they're unlikely to get any benefit from screening for prostate cancer. So in those situations, I would say no, there's no benefit to do so. It's important to realize that the PSA test, which we use as a common screening test for prostate cancer, is not perfect. And before having the test done, I would discuss the risks and benefits with either your urologist or your primary care doctor before pursuing it. So I hear this question a lot, and I'm asked, are there any supplements specifically that maybe will reduce the chance of prostate cancer? There hasn't been any hard evidence to show that any supplements, including any multivitamins, vitamin C, vitamin D, vitamin E, are helpful in reducing prostate cancer. What has been shown to be helpful is basically adapting a heart-healthy lifestyle. So the same changes you make to have an optimal cardiovascular health, maintaining a healthy weight, exercising, making sure your blood pressure is in check, making sure that your cholesterol is well controlled, are in general good for the prostate as well. Urologists are trained to help with many different aspects of men's sexual health. This can involve problems with low sex drive or libido, problems with erectile dysfunction, problems with premature ejaculation, problems with male infertility, or men seeking a permanent form of contraception like a vasectomy. So this is a very common problem that we encounter, and we're trained to deal with a whole range of different issues. And it really doesn't matter how old you are. You should come in and just be forthright with us. We've heard it all, and we're here to help.